Good morning, and thank you for attending. Today, I'm joined by Dr. Carol Zimbalatti, public health physician, who will provide an update on our local COVID-19 situation, and Andrea McLellan, our director of strategy for immunization. And she's going to provide us an update on the vaccine rollout. But before we proceed, I'd like to take a moment to acknowledge that the health unit resides on land covered by the Robinson-Huron Treaty of 1850. This land is the traditional territory of the Anishinaabe people. This land is also part of the unceded territory of the Algonquin Nation. I'd also like to acknowledge the Métis historical presence in the region. So let's continue to work together to further the process of decolonization and reconciliation. All of our communities throughout our entire district have been doing a great job keeping our case numbers, hospitalizations, and ICU admissions low. Our health unit has the second lowest cumulative rate of COVID-19 at 506.5 per 100,000. The Ontario-wide rate is 3,754.1 per 100,000. Our district is less than 2% away from reaching 80% of residents receiving their first dose of COVID-19 vaccine, and only 6% away from 75% of residents being fully vaccinated. This is all great news. Through modeling, we expect the provincial case count to increase this fall. We're starting to see that now. However, this week, Dr. Morse said metrics used to implement broad-based public health measures are being reviewed this month and said hospital capacity and ICU capacity are key indicators. It is expected there will be breakthrough cases, meaning people who have been vaccinated will contract COVID-19, but only 5.3% of cases post-vaccination occurred 14 or more days after dose 2 administration and are considered breakthrough cases. No vaccine for any illness is 100% effective. Public Health Ontario data has found that people are 8 times more likely to get infected if they are unvaccinated, and people 60 years of age and older are 15 times more likely to be hospitalized due to COVID-19 compared to those fully vaccinated. We have heard a number of different reasons why people don't want to get vaccinated. However, we need to remember that by being vaccinated, the risks of severe illness, being hospitalized, experiencing prolonged symptoms, or dying due to COVID-19 are significantly reduced. Also, by being fully vaccinated, you may avoid the need to self-isolate. Most fully vaccinated individuals who don't have symptoms but were exposed to COVID-19 do not need to isolate, meaning less time lost from work, friends, family, and other priorities. In an effort to reduce barriers to the COVID-19 vaccine, the health unit has started to offer clinics within the community and eliminated the need for pre-booked appointments at all clinics. This past weekend, we did have to unexpectedly cancel clinics in Sturgeon Falls and North Bay due to logistical issues, and so we really apologize for any inconvenience this may have caused. Clinics are scheduled throughout the district now. We will be transitioning away from appointment-based clinics over the course of August to a walk-in format and smaller clinics in September. Anyone wishing to receive their first or second dose of COVID-19 vaccine can do so by attending pop-up clinics, regular clinics, or pharmacies in the area that are offering the vaccine. If you haven't done so already, we encourage you to be vaccinated. If you have questions about the vaccine or clinics, we're here to help. So please call us at 1-844-478-1400. With that, I'll pass it over to Dr. Zimbalatti.
Thank you, Dr. Chirico. In the last 7 days, we had 6 new cases, bringing our total case count to 661, with 5 in the Nipissing district and 1 in the district of Parry Sound. The health unit currently has 6 active cases. Preliminary testing for variants has as yet only been completed for 2 of our active cases. Both have screened negative for 2 mutations, which suggests that they are Delta variant cases. Currently, no individuals are in hospital due to COVID-19. Over the past 14 days, 83% of individuals eligible for the vaccine who tested positive for COVID-19 were not fully immunized. A further 3 cases were under the age of 12 and not yet able to be vaccinated. With that, I will pass it back to Dr. Chirico.
Thanks, Dr. Zimbalatti, and we'll have Ms. McLellan will give us an update on our vaccine rollout now. Thank you.
Thanks, Dr. Chirico. Good morning, everyone. As of yesterday at 3 p.m., we are now at 77% of residents 12 years of age or older who have received at least one dose of a COVID-19 vaccine, and 69% of residents 12 years of age and older who are fully vaccinated. Additionally, 64% of youth 12 to 17 years of age have received at least one dose of vaccine, and 47% have received both doses. As of yesterday at 3 p.m., a total of 169,507 vaccinations have been provided in our district. For our district, as of yesterday, this means we need 3,399 individuals to receive their first dose of vaccine and 7,332 individuals to receive their second dose of vaccine to meet that provincial goal of 80% of eligible people with at least one dose and 75% of eligible people fully vaccinated. I'd like to point out that there have been some significant issues with data being pulled from the COVAX system this week as a result of changes to the system that the province undertook recently. As a result of these changes, the data of tens of thousands of individuals across the province has been reassigned to different health units, resulting in data changes across the province. We're working with our other health units and the province to ensure that these remediations that have happened are accurate and our data includes all of our residents. As the demand for COVID-19 vaccine starts to plateau, we are adjusting the way will be offering clinics. We're meeting people where they are at and reducing barriers to accessing the COVID-19 vaccine. We could not do this without the support of our community partners. From local hospitals to EMS, community service providers, and many others, it has taken a village to successfully implement the largest immunization strategy we have ever undertaken. And the health unit thanks all of you for your support, planning, insight, and time to help make the vaccine rollout such a success. As we move towards the end of August, we will be transitioning away from mass immunization clinics and focusing more on small one-off locations. We will continue to make the public aware of these locations through our website, social media channels, and through the support we have received from our local media. Thank you for sharing the locations on our behalf for our clinics. In addition to the one-off locations, workplaces, community organizations, places of worship, and other groups can now request a mobile COVID-19 vaccine through our mobile clinic request form located on our website. The form allows individual groups to submit a request for a mobile vaccination team to come to their site and provide first and second doses of vaccine. To be eligible, groups must have at least 50 members and have a collective interest in receiving vaccinations on site. Our walk-in clinics for the rest of this week include today in North Bay at the North Bay Food Bank from 3 till 6 p.m. Today in the West Nipissing area at the Sturgeon Falls Arena from 4:45 till 6 p.m. Tomorrow in North Bay at Memorial Gardens from 5 till 7 p.m. We hope to see you out at our clinics and in the community accessing your vaccine. Now back to you, Dr. Chirico.
Thank you very much, Andrea. And so that ends our remarks, and I'm going to be turning it over to questions now. And so we'll try to answer as many as we can. Please put them in the Q&A box on the left of your screen. And if we certainly don't have the answer, we'll get back to you as best we can later. And please attach your name if you feel that you wish to do so. Thank you. I'll turn it over to Alex.
Thank you. Our first question is for you, Dr. Chirico. It comes from Chris Dawson from Bay Today. What is your position on proof of vaccinations for public events in the district this fall? Is this something you endorse for all indoor event gatherings, such as sports and entertainment functions?
Well, thank you for that question, Chris. It certainly is on the minds of a lot of people. My position is that, first of all, I think that if that's going to happen, it needs to be done provincially, and there isn't that policy decision that there's much favor for doing such a policy. Locally, I would just really encourage people to get vaccinated, to do risk assessment for themselves and where the venues that they're going to be going to, and take the utmost precautions. But most of all, I think it's very important that people do get vaccinated. That's the best protection, and following public health measures. So no, I think that it would be not something at this time that we would consider or be in favor of doing within our district.
Thank you. Our next question is for Andrea. There are two questions that are asking very similar, so I'm going to read them both. So our first is from Brad Obin at Vista Radio. Though the change has been recent, has the change to pop-up clinics in smaller pockets of the community, such as River Valley and Verner, yielded positive results in terms of vaccinations? With information from your data, what other smaller pockets will the health unit be focusing on? And then from Rich Kaufman at My North Bay Now, are the smaller venues attracting people that may have not gotten the vaccine otherwise, and are you pleased with the turnout?
Thanks for those questions. They're great questions. We are absolutely seeing positive results from these smaller clinics. We attended clinics at River Valley and Verner, and we immunized 62 people in total at those two clinics. And I strongly do feel that a number of these people are people who may not have been able to get to our mass immunization clinics and may not have been able to access vaccine otherwise. And that is why we are trying to get out into some of those smaller locations and smaller communities to try and ensure that people do have access to the vaccine.
Thank you. And a follow-up question for that from Jennifer from The Nugget. Are there certain areas in the district that are lagging in COVID-19 vaccinations?
We're currently reviewing our data around that, Jennifer, to identify areas where our immunization numbers are lower and look at strategies to try and help increase access to those communities. And so we're working with our community paramedic medicine programs in both Nipissing and West Parry Sound are helping us to reach some of those rural areas where we have smaller numbers and lower immunization rates.
Thank you. Our next question is for Dr. Zimbalatti. It comes from Jennifer from The Nugget. I understand the health unit is working with NDA, the high school sports and school boards, to discuss the return to high school sports. When will students hear about what school sports will look like?
Thank you, Jennifer, for that question. So we are meeting with the school boards this week, and we'll be meeting on an ongoing basis to assist with planning for the new school year. So announcements of that type will be forthcoming.
Thank you. Our next question is for Andrea from Eric Thompson. What were the logistical issues that caused the cancellation of pop-up clinics over the weekend?
Thanks, Eric, for that question. The problems were related to equipment and supplies that we didn't have available at the time to allow us to go out. Those issues have now been resolved. Those clinics that were canceled will be rescheduled, and we are moving forward with our pop-up clinics.
Thank you. Also for you, Andrea, from Jennifer from The Nugget. How long do you expect it will take for the district to reach the provincial targets?
That's a great question. It ultimately depends on the number of individuals who attend our clinics. We need 3,300 plus people to receive their first vaccine and 7,200 or 7,300 to receive their second vaccine in order to hit those provincial targets. I absolutely think that they are attainable. I think it'll take us a little bit longer than it would have had we been immunizing the numbers that we had been seeing through our mass immunization clinics. But I do think over the course of the next couple of weeks, we will hit those targets.
Thank you. Our next question is also for you, Andrea, from Jennifer. I understand the health unit was calling those who have only received their first dose, encouraging people to get their second dose. How has the uptake been?
Great question, Jennifer. Yes, we were able to, through the provincial database, identify 5,000 individuals who had had a first dose, but we did not have a documented second dose or a second dose appointment scheduled. So those individuals were contacted directly, and we offered to provide assistance to booking a second appointment, and some individuals took us up on that offer and booked their appointments. Other individuals have chosen to take the walk-in option as that's more convenient for them personally. And so we are seeing people coming in through our walk-in process as well. And then others are waiting until the fall into September to receive their vaccine. And again, we'll be using the walk-in approach.
Thank you. Our next question is for Dr. Zimbalatti from Sarah Bissonnette from the North Star. Testing numbers appear to be rising again as Ontario is in the fourth wave. Locally, numbers of new and active cases are decreasing. Is the health unit noticing any signs of a new local wave that isn't obvious to the layperson?
That's a very good question. Currently, I would say that we aren't seeing that locally. However, historically, our health unit has always lagged behind a bit in terms of the development of new cases with any particular wave. So I don't think we're immune to this. And unless we get a large number of our population vaccinated, I do anticipate that eventually our numbers will increase, especially with the start of school.
Thank you. Our next question is for Andrea from Sarah Bissonnette from the North Star. Have any doses of vaccine been thrown out within the health unit? Have doses been shipped elsewhere near expiry date?
Thanks for that question, Sarah. We have not thrown out any vaccine that we have as a result of expiry or anything like that. We have done our very best to get vaccine into arms. There has been some wastage, very minimal amounts, like I don't know, 10, 15 doses potentially total. And that has been as a result of, we've had some that were a result of defective vials where there either wasn't sufficient vaccine in the vial for a full dose or there was damage to the vial, but we have not had any other wastage that we've had to do, and we haven't shipped any vaccine anywhere. At this point in time, we are in the process of using our vaccine and don't anticipate the need to do that.
Thank you. Our next question is for Andrea from Jennifer from the Nugget, but also from Sarah Bissonnette from the North Star. They read, any update on vaccines for those 5 to 11 years of age?
No, at this point in time, that is still under review. It has not been approved by Health Canada. And so we are awaiting further information from the province at this time. I don't anticipate that we will hear much before September or early October.
Thank you. And our next question is for you, Andrea, from Jennifer from the Nugget. I understand the health unit staff will be vaccinating students in schools. When will that start?
Great question, Jennifer. We are in the process of planning for school-based immunization clinics for students at this point in time, age 12 to 17. In September, we are meeting with our school boards tomorrow. Yep, tomorrow, and that planning of dates will begin at that point in time. But those clinics will be held throughout September to ensure that youth have access to the vaccine.
Thank you. So there are no more submitted questions, so that will complete our press conference for this week. The recording will be made available on our website later today, and we'll see you next week on Thursday at 10 a.m. Thank you.